Let's talk about treatment. If you could give our audience an overview of treatment for MS.
So I like to divide treatment into two categories. One is the treatment of the disease itself. And when I got in this business, we had nothing. There was nothing that would alter the natural course of the disease. So we weren't talking about that. And over the last couple of decades, now we have a big tool chest, and it continues to grow over time. We get newer medications that will change the natural course of the disease. I'll come back to that. The day-to-day symptoms, that's what patients really want. They have all sorts of issues. And some of these we can treat, and some of them we acknowledge we cannot. We're doctors, right? Our tools are mostly medications that we take, or treatments that we can apply, physical treatments that we can apply. But beyond that, we don't really have any magic. People want to know about diet and exercise and acupuncture and, in our part of the world, cannabis and, all the so-called natural things. The science hasn't really given us any evidence that these things clearly make a difference. But you have to stay healthy, right? There's the rest of you that you have to worry about. And a healthy body is so important. In the last couple of years, we've talked about things called comorbidities. So it's a fancy name for what other problems the body may happen to have. And so a person who's overweight, who smokes, who doesn't sleep well, who doesn't exercise, who may have heart disease, diabetes, thyroid, you name it, their MS is going to do much worse. And this is now proven. So when we think about the treatments, you think about not just the brain and spinal cord and optic nerves, think about the whole body.
Interesting.
And treatment has to sort of be geared to all of that.
So in other words, you're trying to treat the whole person, essentially.
Yes.
And if they have other illnesses, get those under control because they do better if the illnesses are under control.
Absolutely.
And if they have stress or if they're sedentary, then getting that stuff tuned up actually helps the person with MS do better.
And now we're recognizing it helps all autoimmune diseases, not just MS. And this is becoming a science. People have put these through clinical trials, patients who exercise, who don't, who are overweight, who are not, who smoke, who don't. And all of these things can affect it. So these are the things that patients can do and need to be empowered to do and need to be encouraged to do, because that will change the disease for them without the drugs. Fortunately, we do have therapies that will work. Some of the symptoms can be treated better than others. For instance, we are getting much better at treating bladder problems, whereas we are nowhere in the treatment of the coordination difficulties that some patients will have. There's some measures that you can take from a rehabilitation standpoint that will reduce the impact of that, but we can't fix it. Let's face it. Some patients have pain. We have to deal with the pain. I wish we could enhance cognitive powers. Same thing is holding true with all diseases that affect cognition. This is where all these now internet games come out. Train your mind, exercise your mind, you'll feel better. This is all very good for the general well-being for patients. Fortunately, we do have medications and treatments that will alter the natural history. These have been evolving since the late 80s. The injectable therapies that have been around for decades, and they're important because they do work in the majority of patients for at least some time. People hate having to inject them, but it's the only way they work, and they're safe. We have not seen from the so-called immunomodulators really any dangerous signals going out decades from people taking it.